Hi friends, welcome back to Bits for Homeo channel. In this video, we are going to discuss the renal stones and the homeopathic therapeutics. Renal stones, it means the stone in the kidney. The renal stones commonly named as renal calculus, renal lithiasis, and there is a difference between the nephrolithiasis and urolithiasis. The nephrolithiasis, it refers to renal stone diseases, and urolithiasis is the presence of stone in the urinary system. These renal stones more frequently occur in the men than in the women, and it is rare in children. It shows a familial predisposition. These renal stones, the stones are mainly composed of urinary salts. The salts like oxalate, calcium, cysteine. When these salts are more excreted in the body, they are not insoluble in the urinary constituents. There are many more causes for the formation of the renal calculus, like hypersecretion of the salts and not soluble in the urinary constituents, and the physical changes in the urine, and the decreased concentration of crystalloids, and altered urinary crystalloids and colloids, and vitamin A deficiency, and previously urinary infections, and the hyperthyroidism also one of the cause for the renal stones, mostly seen in the 2 to 5% of cases of the renal stone. For selecting the homeopathic individual single remedy, we should be keen with the clinical features. These renal stones have 5 major clinical symptoms. 1. Fused calculus, and second one is most important in pain, and third one is hydronephrosis, and fourth one is hematuria. Quiescent calculus means inactive renal stone. The patient having with the renal stone, but it does not produce any symptoms. Mainly these stones are phosphate type stones. During this time, the stones are gradually increase their size. By increasing their size, they destruct the renal parenchyma. These stones present in the patient's body, but there is no symptom. These are diagnosed by accidentally. When the patient went to the hospital by renal failure or uremia, it is diagnosed with the X-ray, and we will find some stones in the kidney. And the second symptom is pain. Pain is the most important symptom in the renal stone. There is 3 types of pain in the renal stones. One is fixed renal pain, and second one ureteric colic renal pain, and third one is referred pain. Fixed renal pain. If the stone is free and obstructed or fixed at a place or at a point at calyx or uretero-pelvic junction, there will be pain in the flank region. The pain is dull flank. The dull aching or boring type of pain is also experienced in the case of the big phosphate calculus. The dull aching pain and boring type of pain is seen in the fixed renal pain. The pain is situated at posteriorly by renal at the renal angle and anteriorly at the hypochondriac region. This pain get worsened by the movement, particularly walking up the stairs and during the jogging. These pains and aggravations are important for the homeopathic therapeutics. And the second pain is ureteric colic pain. In this, where the fixed renal pain is just attempt to pass down to the ureter and blocks the pelvic urinary junction. In this type of patients, there is a agonizing pain radiates from the loin to groin region. This patient suddenly becomes agonizing, and in the patient the pain comes suddenly, and the patient rolls his knees towards the chest and tossing on the bed in the agony. Because of the reduced body temperature, there is a profuse sweating and little bit of nausea and vomiting where the pulse is increased. Sometimes this pain is referred to the scrotum or labia majora or into the inner side of the thigh. In these patients of ureteric colic pain, there is a colic pain which variable for a period, usually 6 to 8 hours. Then first it starts suddenly, and after 6 to 8 hours it goes suddenly. And the third pain is referred pain. It is quite rare pain, that is referred pain. It is referred to all over the abdomen. Such pain stimulates towards the peptic ulcer or the gallbladder diseases. Sometimes pain may refer to the opposite kidneys, which also known as renal reflex. Third one is hydronephrosis. Sometimes the patient complains about the lump in the loin region and there is a dull ache, which is due to the hydronephrosis caused the renal strain. And the fourth one is most important, hematuria. This is the leading symptom and only symptom of hematuria. Hematuria usually occurs in the small amount to make the urine dirty and smoky during after the attack of the pain. Physical signs. In the majority of the renal stone patients, there is a less characteristics of the physical signs, but we can see such as tenderness and the swelling, and there is some of the muscle rigidity. When coming to the tenderness, it is mostly seen at the renal angle and posteriorly, and hypogastric region at anteriorly. This tenderness is only seen when the renal calculus is associated with the infection, and there is some muscle rigidity in the kidneys found in the few cases, and there is a swelling when there is a hydronephrosis or the pyelonephrosis associated with the renal calculus. There is a swelling in the flank region. Now relate these clinical features of the renal stone with the homeopathic therapeutics. This homeopathic therapeutics has most scope in the to reduce the renal stones. The major and the top remedies you have to think of, the one berberis and second one is cantharis. These two are most when coming, and next third one is lycopodium and fourth one is sarsaparilla, and some extra medicines are also there, but these medicines are major important. After doing the repertory with the symptoms of the renal stones, most of the renal stones show the importance of the beriberi. Say how much importance is pain extending from the abdomen to inguinal region is beriberi, extending back to the beriberi, extending in all directions is beriberi, extending to genitals, extending to lower limbs, extending lower limbs to hip and lower limbs to knee, lower limbs to thigh. Most of the symptoms covers the beriberi. And the another remedy is cantharis. Pain extending to the ureter along the penis and the pressure on the glands, amelioration, and at the times the pain goes upward, and the constant region pain in the kidneys. The most selected remedy after the beriberi is cantharis, and there is lycopodium and there is sarsaparilla in the same way. Beriberi vulgaris. These characteristic symptoms only taken from the Allen's keynote symptoms. No other extra points added from the other authors. The first point is pain is very sensitive at the renal region, and it is aggravated when sitting and lying. At the same time, very sensitive to touch, and there is a burning and soreness in the region of the kidney. When the patient urinates, there is a stitching and cutting pain in the left kidney, and the pain starting from the course of the ureter into the bladder and the urethra, and there is a bubbling sensation in the kidney, and the urine is greenish and blood red color, and with this thicky and transparent mucus or reddish or jelly like urine. The canthar is mostly helpful while in the urination problem, but in the beriberi vulgaris there is pain in the kidney region and at the course of the ureter. In coming to the canthar is main problem with the urination. There is always constant urgination to urinate, but passes a few drops urine at a time, and there is even he drinks a small quantity of water, it increases the pain in the bladder, intolerable urging of the urine, and before the urine and during the urination there is a violent pains in the bladder, burning and cutting pains in the urethra during the urination. This cantharis helps in the most problems and pain during the micturition. Coming to the lycopodium, there is a terrible pain in the kidney region and scanty urine during the daytime and profuse at the night time. Pain is at the back. There is a drawing and aching pains. Mainly in this lycopodium, there is red sand urine. Child cries before urinate. Pain is relieved by urinating. And the next remedy is sarsaparilla. In sarsaparilla, the patient with painfully distended and tenderness in the bladder, and the urine dribbles while sitting and standing and then passes freely, and the patient generally passes the small calculi or the stone in the bladder or the bloody urine. The urine coming from the bright red in color deposits while sand in the urine. Other remedies like belladonna, naxwamica, laxis, and there are more. These 4 symptoms are the major homeopathic indications for the renal stones. Thank you for watching. If you like this video, please comment and then share and subscribe